There you go. It's already on. So, we see this a lot, abdominal pain, we think could be appendicitis. What are the physical exam findings that we're going to test for? And you'll see most doctors won't even do this. They have tenderness. It all become about testing, It's all become about you got to prove what they don't have. So you do a blood count, you do a CAT scan. Sometimes you can do an ultrasound for appendicitis and stuff. But let's say we were in South America and we're examining a kid and we don't have access to CAT scan. You want to do as many physical exam tests as possible to prove or disprove whether or not they have peritonitis. You can't prove they have appendicitis. You can only prove they have localized peritonitis. So let's walk through one of the tests. The one of the tests we'll do is we'll ask the patient to relax his leg. Let me bend it and cross it over. This is called the obturator sign. So you'll tell him to lift the knee up to push against you. And then you'll do it again with the other leg like this. And if they have pain when they do that, that is a positive obturator sign, basically because you're using the obturator muscle, putting tension on it, pushing against the appendix. The other thing you'll do is heel tap. So you'll straighten the leg, you'll go like this, and you hit their heels. And that can provoke the jiggle of the peritoneum and cause pain. An alternate way of doing that, if they're walking, you tell them to stand on their toes and drop on their heels. And that drop, they just can't do it. They have apprehensions called it. Like, no, I can't do it. They won't. There is a psoas test in which you lay them on their side, actually like a little bit of an angle, and you actually hyper extend. I'm sorry. Go ahead on your side. You actually go with the leg like this, and that puts pressure on that too. Okay, go back on your back. And then there's the two main signs that you look for, the McBurney sign. So you look at the superior iliac spine, your belly button, and 1/3 of the way, that's the McBurney's point. You press on their tummy, and when you release, if it hurts more when you release than when you press, that's a peritoneal sign, that's positive Murphy sign. I'm saying no, McBurney's, Murphy's for the gallbladder. But if you do on the contralateral side, on the left lower quadrant, you press and you let go and they hurt, that is actually called a rubbed Singh sign. And that's actually even more specific of regional peritonitis. But whenever you see something like that, so you think it's appendicitis because they have heel type obturator that hurt when you let go, there's still other things it could be. It could be a regional colitis, like an ileitis. Could be mesenteric adenitis. Mesenteric adenitis is the big mimicker of appendicitis in kids. It could be a focal bowel obstruction. I mean, the whole thing about bowel obstruction is having to have a distended belly and vomiting, and they can't be passing gas. That's all good, and there's things we ask for, but it's not definitive. You can have a bowel obstruction and be passing gas, be vomiting, and so on. So there are other causes of local abdominal pain like that. Even kidney stones shouldn't really be tender, but we see many patients that they just have so much pain that and you're like, oh, maybe it's appendicitis. It's a kidney stone that's obstructing. So that's it. The physical exam findings of appendicitis, why we do them, why we don't, and that's it. Thank you.